read about medicine in the Middle Ages today. First off, the questions. Number one, in the Middle Ages, who oversaw medical training? Number two, how did physicians learn anatomy, the structure of the human body? Three, what did physicians believe to be the cause of illnesses? Four, what herbs were used as pain relievers? And five, who did physicians actually treat during the Middle Ages? So, medicine in the Middle Ages, 1100 to 1400. During the Dark Ages, Common Era 400 to 1100, there was little progress in medicine in Europe. As Europe moved into the Middle Ages, however, this began to change. Doctors in the Middle Ages. In Common Era 900, the first European medical school in Europe was established at Salerno. Others followed. The works of Galen and other ancient writers were rediscovered and taught. By the late Middle Ages, physicians from the word physic could only practice medicine if they had been trained at one of the medical schools. The church oversaw medical training. The ideas of Galen were encouraged because they fitted in with religious ideas. Knowledge of anatomy was gained by studying books and through dissection of dead bodies. Physicians were bound by the Hippocratic Oath. Women were not allowed to go to university or become physicians. Women did, however, continue to give day to day care of the sick and continue to act as midwives. Causes of illnesses. Many physicians believe that illnesses were due to common sense reasons, bad smells, and etc. Imbalance of the four humors, position of the sun and planets, punishment from God, or poisonous fumes. Treatment. Physicians would often study a patient's urine and or use astrology before deciding on a suitable treatment. Due to belief in maintaining the balance of the four humors, bleeding was a very common treatment. Surgery was not taught at universities. Surgeons learnt surgery by watching an established surgeon. Physicians often worked as army doctors, treating those injured during the many wars of this period. Herbal concoctions such as hemlock, mandrake, wine, or opium were used for pain relief. Herbal remedies were widely used for many everyday illnesses. Preparation of herbs improved due to the improvement in equipment made by scholars interested in alchemy, trying to turn cheap metals into gold. Hospitals. The Catholic Church thought that it was a religious duty to care for the sick, but it was not until the 12th century that the church provided medical schools. Of the hospitals that were in existence, only 10% actually provided medical care. They were called hospitals because they provided hospitality, food, housing, food, and clothing for the needy. Monks and nuns cared for people in hospitals. Physicians were rarely seen in hospitals. They treated kings, nobles, and wealthy merchants, not ordinary people. All right, going to answer the 5 questions on its learning.